A new injectable medication for HIV prevention is now covered for First Nations and Inuit under the Non-Insured Health Benefits program, or NIHB. Apretude is a bi-monthly injectable that's more than 99% effective at reducing the risk of HIV transmission through sex. Certified registered nurse and Two-Spirit Health Director Jessie Dame says Apretude is very exciting when it comes to combating HIV in Canada.
It's an injectable, so folks can get as minimal as 6 injections a year, which is extremely decreases barriers to pill access and to continuously having to go to pharmacies.
The human immunodeficiency virus, or HIV, weakens the immune system against disease and illness and can lead to AIDS if left untreated. HIV is primarily transmitted through sex without condoms and shared injection drug needles. HIV can be acquired no matter your sexuality, gender, or race, but some communities are more impacted than others. The Public Health Agency of Canada estimated more than 62,000 people in Canada were living with HIV at the end of 2020. In that same report, they found Indigenous people made up approximately 10% of all people living with HIV in the country, though Indigenous people make up about 5% of Canada's population.
Indigenous people continue to represent the highest, or some of the highest numbers around HIV transmission within the country, and especially when we look at Two-Spirit, queer, and trans Indigenous folks. I think it's really important when we talk about HIV to really make sure we talk about the context. So unfortunately, Indigenous people are disproportionately affected by HIV, but that's due to racism and homophobia, biphobia, and transphobia. So really putting the blame on the systematic structures that lead to the increase in HIV.
HIV prevention medication is also called pre-exposure prophylaxis, or PrEP for short. Oral PrEP pills were already covered under NIHB before the Apretude injectable became available, but are less effective and require daily dosing or on-demand use. Dame says spreading more awareness and promoting education around PrEP and HIV is necessary for seeing lower transmission rates.
More conversations or kitchen table conversations is important. So we need to look at structures that support family members to get access to knowledge, to bring it home to community and share in community spaces. So we are currently investigating what Indigenous knowledge mobilization looks like and working with community to find and develop new tools.
You can find more information on the Apretude injectable at apretude.com or visit can.ca for resources on HIV within Indigenous communities. Jonsa, APTN National News, Winnipeg.